In this presentation, I'm going to provide you an overview or introduction to taping. So first, what do we do when we're getting ready to tape somebody? We want to make sure the skin is clean. So it should be clean of oil, perspiration, and dirt. So if a person is in the middle of practice, we usually have to clean it first before we tape it, because the sweat and oils will cause the tape to slide all over the place. We don't do this a lot. We don't really require somebody to shave their legs, but it is better if they do not have a lot of hair, because it does start irritating the person's skin if they're getting taped a lot. We typically use, as this picture shows, is a tape adherent called QDA, or tough skin is another name of it, and we spray it on. You'll see in the videos, the taping videos, that I always pretend I'm spraying the person's body part that we're taping. This is to make sure that the tape adheres or sticks to the skin. And again, we don't want the skin to, or the tape to slide around the skin, because that's how people get blisters or they get tape cuts. We use foam and skin lubricants. The picture on the left bottom is, they are called heel and lace pads. And we use these in areas that have high friction, and again, to reduce the amount of blisters that somebody will get with taping. We typically, most people say tape directly to skin, but usually we use pre-wrap, as the picture shows in the top right. It's a roll of thin foam, and we typically use this more than we tape direct to the skin. Some athletic trainers will only tape direct to the skin, so it's a philosophy of taping. I typically use pre-wrap. A pre-wrap should be applied one layer thick. That picture that I show is actually not a very good picture. I couldn't find a good picture of that. That pre-wrap is a little bit too thick. It should be one layer. You want it to be just right over the skin. Again, because we want the tape to be as close to the skin as we possibly can. We want to then anchor that pre-wrap with some tape, so the pre-wrap doesn't start rolling up. When we tear tape, and as the picture shows, we try to have our fingers and thumb together, and we should tear the tape. It's pretty difficult to learn how to tear tape. You want to make sure you don't bend the edges of the tape or wrinkle the edges of the tape, because once you do that, you're never going to be able to cut it. I really don't want you to use scissors when you cut tape, especially the athletic tape, the 1.5 inch athletic tape. It should be a straight edge with no loose strands. Some tapes, in the taping video, the different types of tape video, the elasticon tape, you cut with your fingers. You have to have really strong hands. But typically, you should be able to cut most athletic tape with your fingers. Some rules for tape application. You want to tape the body part in where the joint is the most stable. I have a picture of the ankle. In each of the taping jobs, one of the requirements is that you say and put the patient or the athlete in the correct taping position, because those taping positions do matter, because we want that joint in the most stable position, where that's the whole reason why we're taping, is to make sure that we are reducing the amount of possible injury. When we tape, we want to overlap each tape strap by a half. So if the tape is a half inch, inch and a half, we want to go about right in the middle of that next layer of tape. So the picture down on the bottom left tries to show that. We want to avoid having continuous taping. So when we do the ankle tape job, when we do heel locks, you'll see in the video for the ankle tape, I have you do 4 heel locks. Most athletic trainers have been taping a while will do one heel lock, then two heel locks, so combining the 1 and 2 that I'm doing in my tape job. But when you're first learning how to tape, it's not great to do continuous taping because you can make it really too tight, and that causes the person who's wearing the tape to be uncomfortable, and they're going to end up cutting it off because it's uncomfortable. Keep the tape rolling in your hand whenever possible. Younger people who are first learning how to tape, especially with the ankle, they want to put a piece of one of the strips of tape on, especially when we get into the stirrups and the heel locks. They want to put the tape down, but to save time and to tape faster, keep the tape roll in your hands at all time. And in the videos that you'll be watching of me taping, you'll see that I use both hands when I tape. I have the tape in one hand and I'm smoothing as I'm going with my other hand to try to keep that tape as smooth as possible. We don't want any wrinkles when we tape. Other thing is how much pressure to hold when you're holding the tape. It's really hard to explain that. You want the tape to be tight, but you don't want to have it so tight that you hurt the individual, because they're just going to cut the tape job if it's not comfortable. And allow tape to follow the contours of the tape. This kind of goes along with another of my sayings is don't force the tape to go where it shouldn't. So the tape should follow the way that the body shape is. You'll see in some of my other videos on when we tape, I talk about the shape of the body and how we should tape. And so, as I say, don't force a tape to go where it shouldn't go. And that's not a good sentence there. So don't force a tape to go somewhere it shouldn't go. So if it's going to go somewhere where you don't want it to go, you're going to get wrinkles. So part of all this is having the right angles when you're taping. So like on this particular picture, and the picture on the bottom right corner, that is showing a heel lock, and there are particular angles for the body, and you have to follow those body angles like I was just talking about earlier, and it just takes time and practice on learning how to tape. Other thing you want to do is start each tape job with an anchor. That would be the picture in the top left corner of this picture. So you put in my ankle tape jobs, I do 2 anchors on the lower leg and 2 anchors on the midfoot. And then you close out the tape job by closing everything up, by interlocking tape jobs. So on the bottom left corner of that picture, they show the closing strips. So you want to lock up those closing strips. Then you'll notice that when we do, especially an ankle tape job, is that we apply strips between strips. So that's what the picture on the top left is showing, that we have strips between strips. Those are stirrups and a U-strips. Again, this is a philosophy of taping or not, where maximum support is desired, tape directly to the skin. Again, I don't do this a lot. I typically can do stuff with pre-wrap. And do not apply tape if the skin is hot or cold from treatment. So if somebody just got out of a cold whirlpool, got to let the skin warm up because it's too small, or it can be too big when it's super hot. So if we did some kind of heat treatment, don't want to use tape right afterwards. You need to let the body to get back to normal treatment, or normal temperature, sorry. Removing tape. Once we get tape on, we can manually remove it. Always pull the tape in direction in line with the body. One hand pulls the tape while the other hand presses the skin in the opposite direction, sort of like pulling off a Band-Aid. This takes forever, but if you don't have any other way to do this, that's what you got to do. So you can use scissors or sharks. That's a tape shark. You want to make sure you're not too aggressive, especially with the injured area when you're doing this, especially if you got a sprained ankle. Got to be careful not to hurt yourself when you're cutting the tape off. It's always easier to do it yourself than versus having somebody else do it. So on this picture, it shows how we should cut off tape. We want to use a shark or scissors. And we're going to insert the blunt end under the tape. That's why on athletic training tapes, there's a blunt end on it. Or, sorry, athletic trainer's scissors, there's a blunt end on it. And same with the shark. And you pull up as you slide down, pull the skin from the tape, not the tape away from the skin. Be careful, look for blisters or other skin irritation as this tape is removed. So I've heard, if you see on the picture with the scissors and the red arrow, it shows how you should cut off ankle tape. I've heard both different ways to do it. One is to cut the tape above the ankle bone or the malleolus, or I've also seen people cut the tape below the ankle bone or the lateral malleolus. Again, it's really time with practice to do this. Your shark scissors or shark blades have to be super tight, or super sharp for you to get the tape off. Again, this is just an overview of taping. Hopefully this has been helpful for you to understand how to tape.